In responding to the COVID public health emergency, legislation that was passed in early 2020 required states to provide continuous Medicaid coverage, even to those who were no longer eligible. Recent legislation ended the continuous coverage requirement as of March 31st, 2023, and directed that states return to normal redeterminations and operations over the next 12 to 14 months. Over 5 million Medicaid recipients will have their eligibility reviewed, and many will be terminated from coverage. Florida's redetermination plan includes a timeline which shows that the Department of Children and Families, DCF, will send notices informing current recipients that their Medicaid eligibility is expiring and needs to be reviewed. These notices are sent around the middle of the month. Individuals who are no longer eligible or who do not complete the review will be sent a notice informing them that their Medicaid will end on the last day of the month. The notice will include information on how to appeal, and if the reason for termination is the failure to renew, clients will have 90 days to reapply with no gap in coverage. That process will be repeated each month through April 2024. Many recipients will need help in understanding if their termination notice is correct and what to do. This video was created as a basic training tool for legal services staff, navigators, social service providers, and others who are assisting Florida Medicaid recipients. It provides a general overview of Florida's Medicaid program, including who is eligible and how to determine the income eligibility for different family members. It will explain why Florida's parents and caregivers, as well as 19 and 20-year-old youth, are among those most likely to lose Medicaid. And it describes the Medicaid programs that people losing full coverage could still be eligible for. The video is divided into topics with timestamps so you can easily go to the desired content, and there are resource materials in the portal located directly below the video. When new information is available, the Florida Health Justice Project will provide updated materials in the portal and on our website. DCF's current plan states that as of December 2022, an estimated 900,000 cases have been identified in which one or more individuals in the household are no longer eligible. In understanding who is most likely to lose eligibility, it is helpful to provide a basic overview of Florida's coverage categories. In order to be eligible for Medicaid in Florida, someone must be either in a family-related coverage group, which includes parents or caregivers of a minor child, pregnant women, and children, or in what is called an SSI-related coverage group, which includes people who are age 65 or older, blind, or disabled. This chart from DCF shows the Medicaid income limits for individual family members, including adults, pregnant women, infants under age 1, children age 1 through 5, and children age 6 through 18. If you are helping people figure out the Medicaid eligibility for different family members, it is important to understand how to use this chart, which, along with related materials, can be found in the portal. Let's walk through a hypothetical in which you are scheduled to interview Clara, a mother of 3 children, age 4, 18, and 19. The notes you were provided before the interview indicate that everyone in the family has been on Medicaid since March 2020, when Clara lost her job early in the pandemic, and that she is now working, but the intake notes do not provide her income. You want to figure out what the relevant income limit will be for each family member before your meeting with the mother. Here's how you do that. Starting with the mother, beginning in the far left column of the chart, you know that the family size is 4. Moving to the right, you see the column labeled Parents, Caregivers, Children 19 and 20, and the number there is 364. Continuing to the right on the chart, you see a column titled Standard Disregard, and the number is 221. And moving to the far right, the last column is titled Magi Disregard, where the number for a family of 4 is 125. So after you add up those numbers, you know that if the family income is more than $710 a month, Clara, the mother, will no longer be eligible for Medicaid. This summary chart, which is also in the portal, eliminates the math exercise of adding up the base amount plus the relevant disregards and just shows the Medicaid income limits for each coverage group. You can see how the income limit gradually decreases as the child gets older, going from 211% of the federal poverty level for infants under age 1 to 145% for children 1 to 5 to 138% for children 6 through 18. And then when the child turns 19, income eligibility plummets to less than 30% of the poverty level, or only $710 a month for Clara's 19-year-old. This is the same meager income limit that applies to parents and caregivers. However, there are special circumstances in which 19 and 20-year-olds can apply for Medicaid as a household of one and stay on Medicaid. Those situations will be discussed later in the video. But for now, let's focus on Clara's younger kids and calculate their eligibility using DCF's official income eligibility chart. For the 4-year-old, you also start on the far left with a family size of 4. Move to the right to find the category for the child, and you see the column children 1 through 5. And the number in this column for a family of 4 is 3325. Again, moving to the right, you then add the standard disregard of 175. And moving to the far right, you add the Magi disregard of 125. So after you add up those numbers, you know that if the family income is no more than $3,625 a month, the 4-year-old will still be eligible. For the 18-year-old, again, you start on the far left, find the line for a family size of 4, and move to the right. The income limit for the 18-year-old is also $3,325, but there is no standard disregard for older children 6 to 18. You only add the Magi disregard in the far right, which is the same, 125. So after you add up those numbers, you know that if the family income is no more than $3,450 a month, the 18-year-old will still be eligible for Medicaid. Again, if you don't want to do all that math, this chart reflects the income limits for each group. And the important thing to keep in mind is that most children in Florida should remain eligible for Medicaid or Florida Healthy Kids because the income limits for children are much, much higher than the limit for parents and caregivers. Let's go through another example, which is also in the Q&A. Zoe, a parent with 2 children, lost her job in April 2020 and enrolled in Medicaid along with her kids. She got another job in June 2020 with a monthly income of $1,000. Going back to the chart, you see that under Florida's normal rules, Zoe would no longer be eligible because the income limit for parents with a family of 3 is only $303 plus the standard disregard of $183 plus the Magi disregard of $104 for a total of only $590 a month. So with an income of $1,000 a month, Zoe is well over Florida's very low Medicaid eligibility limit for parents. Along with parents and caregivers who are now over income for Medicaid, another group of adults who will lose Medicaid are those who no longer have any children under age 18. Under Medicaid rules, adults who qualified for Medicaid as a low-income parent or caregiver lose their eligibility when they no longer have any minor children. For example, Angela, a grandparent taking care of her youngest grandchild, Hugo, lost her job and enrolled herself and Hugo in Medicaid in April 2020. Hugo turned 18 in May 2022. Angela has not gone back to work. She still has no income, But because Hugo is no longer a minor, Angela is no longer technically eligible for Medicaid as a low-income caregiver. While Zoe and Angela will no longer be eligible for Medicaid under the parent caregiver coverage category, it is important to remember that when someone loses Medicaid under their current coverage group, they may still be eligible for Medicaid under another coverage group. Zoe, for example, who is over income for coverage as a parent, might still be eligible for Medicaid if she is pregnant. Or Angela, who is no longer eligible for coverage as a caregiver because she is not taking care of any children under 18, might still be eligible if she is 65 or disabled. And so before terminating their coverage, DCF must first review their files and determine if they are eligible for a different Medicaid coverage group. Under Medicaid law, this is part of what is referred to as the ex parte review requirement. Also, when DCF sends a notice of case action terminating Medicaid because a recipient is over the income limit for their coverage group, the notice should also inform the individual that they have been enrolled in the medically needy program and specify the individual's share of cost, which is like a deductible. It is important to help people understand their share of cost. For example, let's assume that Zoe, who is now over income for the parent coverage group, is also neither pregnant nor disabled. She will get a notice from DCF saying that her Medicaid has ended and that she is enrolled in the medically needy program with a share of cost of $514. Under the medically needy program, Zoe would be eligible for Medicaid after she has medical bills of at least $514 and then for the rest of that month. To check if her share of cost was correctly calculated, you look at the chart for family size of 3. Find the column labeled MNIL to the far right, which stands for medically needy income limit. You subtract that number, $486, from her monthly income of $1,000. Thus, you can inform Zoe that her notice is correct with regard to the Medicaid termination and the medically needy share of cost of $514. Additionally, many women losing Medicaid should be enrolled in the family planning waiver. This program, which provides family planning health services, is for women under age 56 who are losing Medicaid coverage. The medically needy program and the family planning waiver are definitely not substitutes for the full Medicaid coverage that many parents and caregivers will be losing. However, the good news is that many will be eligible for a subsidized healthcare plan. The Covering Florida program has navigators in each region of the state who are eager to help people losing Medicaid. They can explain a person's healthcare options and assist with enrollment in a new low-cost healthcare plan. But while many of these adults who will be losing Medicaid will be eligible for a subsidized health insurance plan, if their income is below 100% of poverty, they will not be eligible for a marketplace subsidy. They will be in what is called the coverage gap. The coverage gap exists because Florida is one of the very few states that has not expanded Medicaid under the 2010 Affordable Care Act, which provided 2 paths to coverage for people with low to moderate incomes. First, people with moderate incomes, 100 to 400% of the federal poverty level, would receive subsidies to help pay for insurance in the new healthcare marketplace. Second, low-income adults under age 65 would get healthcare coverage through expanded state Medicaid programs. Income limits for all adults would go to 138% of poverty. However, in 2012, the Supreme Court ruled that the ACA's requirement that states expand their Medicaid program to cover low-income adults would instead be left up to individual states. Thus, because our state is one of the few that has not expanded Medicaid, many Floridians who have been receiving full health coverage during the pandemic and are no longer eligible for Medicaid will also be ineligible for an ACA subsidy if their income is below 100% of the poverty level. Zoe, for example, will be in the coverage gap because her family income is over Florida's limit of $590 a month, but less than 100% of the poverty level, or $2,072 a month for a household of 3. Importantly, her children remain on Medicaid if they are under age 19. And remember earlier we said that there are special considerations for 19 and 20-year-olds. Let's go through the earlier hypothetical of Clara with 3 children, ages 4, 18, and 19. Clara lost her job early in the pandemic. She then went to work and now makes about $1,000 a month. Her 19-year-old daughter, Olivia, works part-time and earns $300 a month. While the 4-year-old and 18-year-old will remain on Medicaid, both Clara and Olivia will be terminated as over-income, since the limit for parents and 19 and 20-year-olds in a household of 4 is only $710 a month. And because the family's income is well below the federal poverty level of $2,500 a month, they will both be in the coverage gap. But Olivia, unlike her mother, may be able to remain eligible for Medicaid. Under certain circumstances, she can file for Medicaid as a household of 1, which has an income limit of $350 a month. First, though, Claire and Olivia need to understand the rules and considerations for 19 and 20-year-olds filing as a household of 1. One consideration is taxes. Importantly, if Olivia files as a single household for Medicaid, Clara cannot claim her as a dependent on her taxes. Another consideration is if Olivia still lives at home. Under Medicaid rules, Olivia can still live in the home with her mother if she files her own tax return, or even if she does not file her own tax return, she can still live at home, file on her own for Medicaid, and not count her mother's income if she is not a full-time student. Assuming Olivia is eligible to apply for Medicaid on her own, a major consideration is if she has health conditions, which make it important that she stay on health coverage and not risk any interruption in her insurance. Another consideration is if the family would be eligible for subsidized insurance. Under this hypothetical, because the family's income is less than the federal poverty level, Olivia would be in the coverage gap along with her mother unless Olivia files for Medicaid on her own. To summarize, we can expect that the largest number of Medicaid terminations will be among parents, caregivers, and 19 and 20-year-olds because their income limit for eligibility is so low in Florida, and many are now over income. These are also the 2 coverage groups that have experienced the greatest rate of increase while the continuous Medicaid coverage requirement was in effect. And again, while many will be eligible for a marketplace subsidy, some will be in the coverage gap. In working with those individuals, helpful actions include providing them with information on their local safety net, the statewide coalition working to expand Medicaid, and how to share their story. Finally, a recap on actions everyone should do before they get their renewal notice, including if the person is potentially disabled, they should be advised to apply for benefits with the Social Security Administration. If possible, they should create an online access account, and everyone should make sure that their address and other information with DCF is up to date. And going forward, if you are working with individuals who did not get a clear or correct termination notice following their renewal, you can refer them to their local legal aid program or the Florida Health Justice Project.